Welcome to Represent NYC of Manhattan Neighborhood Network. I'm Deborah Glick, and I represent New York State's 66th Assembly District, which includes the Village East and West, Tribeca, and Soho. Today I'd like to discuss Assembly Bill 4958, which, if passed, would ban conversion therapy practices for minors. I'm joined today by Dr. Barbara E. Warren, who is Director for LGBT Programs and Policies in the Office for Diversity and Inclusion at Mount Sinai Health System. She has over 30 years of experience in the development and implementation of substance abuse, mental health, HIV, and public health programs in community-based settings. I'm also joined by Dr. Jack Pula, a psychiatrist in private practice in Manhattan, a faculty member of Columbia University's Division of Gender and Sexuality, and a member of the American Psychiatric Association's Working Group on Gender Dysphoria. Dr. Pula is on several other professional committees devoted to LGBT care and is a self-identified transgender man. Thank you both for being here with me today.
Thank you.
Earlier this year, in the Assembly, we passed my bill on conversion therapy, which is a discredited practice that targets efforts to change a young person's sexual orientation. Most associations that deal with mental health have vociferously come out, as well as the American Pediatric Association. We heard from people who had horrifying stories, and so I'd like to hear from your perspective concerns that you have, because we haven't passed it in the Senate. While it is now law in California, New Jersey, and I believe Oregon just passed it, it's not law in New York State, and we have the hurdle of the state Senate to overcome. So we'd like to enlighten the viewers and ensure that people understand and reach out to their friends, neighbors, co-workers to lobby in favor of banning the practice. So Barbara, would you like to start off?
Sure. We've known for a long time, and as a practicing psychologist and as someone who's been devoted to advocating for the most effective and most competent health care for LGBT people for many years, we've known for a long time that conversion therapy, or what now is called sexual orientation change efforts, which covers like any kind of intervention that's designed to force a person to change something that is natural to them, like their sexual orientation and their gender identity. We've known for a long time that that there are insidious practices, that there's no evidence to support, number one, that they work, and that in fact it's abusive towards LGBT people. And minors in particular are vulnerable because oftentimes they do not have a choice in being able to determine who they get to see, and oftentimes their parents, who are for whatever reasons are worried about them, will drag them into seeing therapists and to try and get them to change sexual orientation or gender identity behaviors that don't conform to norms, societal norms. But we've come a long way in the last 20 years, and we now know that sexual orientation and gender identity takes many forms, is natural. People are who they are, like Lady Gaga says, born that way. In fact, we have laws to protect people around discrimination efforts, particularly in New York State, we do. There's absolutely no reason. There's no evidence-based reason. There's no ethical reason. There's no reason at all to practice any kind of reparative or conversion therapy around sexual orientation or gender identity. Strangely enough, though, I still see people in my private practice, and we still have people coming to us in the Mount Sinai Health System who have undergone therapies where sometimes even well-meaning clinicians try to talk them out of sexual orientation, LGBT sexual orientation, or even their gender identity. I think passing a law sends a very strong message. Dr. Pula is going to talk about the ethics in all of you mentioned the professional associations. It's highly unethical behavior. If you're a psychologist, a psychiatrist, a licensed mental health provider, or a social worker who does mental health care, you belong to a professional association. All of those professional associations now have ethical principles that say that it is unethical practice, and in fact, it's grounds for expulsion from those societies and those associations if you practice any form of conversion therapy. However, that may not be strong enough to prevent people from doing it. So having a law in place might also send a very strong message that it's not okay.
Thank you very much. Jack, if I could ask you, since the bill would make, it's good to hear that the societies have their standard of ethics. We would like the state education department, which actually controls people's licenses, to have this as grounds for misconduct. That's what the bill does. So I'm wondering if you in your practice have seen people who have undergone these and what the result has been for them, as you know, the way in which it's affected their psyche.
Mm-hmm. Well, I've seen a lot of LGBT patients in my practice who are adults, and some of them are, late adolescents, and I hear stories about them seeing therapists when they were younger and trying to be, steered in a particular direction, or their sexual orientation or their gender identity being ignored completely, and that they're coming to me with high rates of depression and high rates of anxiety and intense internalized homophobia or internalized transphobia that takes a very long time to work through. So some of the stories that we hear in the media about very extreme forms of conversion therapy where there's a lot of sort of bizarre tactics used, or very abusive things happening. I haven't heard so much about that in my patients, but that is something that is in the literature, and it's been studied since the late 70s. The APA, both APAs have come out against it and shown that there's no evidence that you can change a person's sexual orientation this way. Now, these days, we're also concerned about gender identity and gender expression. Gender expression is often part of how a person is perceived and their sexual orientation is perceived. So early in the 70s, when we were looking at these types of therapies, so-called therapies, that's what they were going after. They will take a youth who may be a boy who's effeminate, and they're worried that he's going to become gay, and they will do things to try to change his behavior and change his gender identity. So that's one of the mechanisms that have been used to try to, quote unquote, convert people. It doesn't work, it's harmful, we know that, and it can lead to high rates of depression, anxiety, and unfortunately suicide. So I see a lot of patients in my practice who are either suicidal or have been suicidal, have been hospitalized. And I've gone through, my own experience of psychotherapy and psychoanalysis, and struggling with, very deep feelings of shame. To have anybody telling you that you shouldn't be who you are, or you should be something different, or trying to coerce you in that direction it's just harmful. It's not helpful.
Well, I think most gay people, from their experience, can say that when certainly someone of my generation can say that the feeling that they were the only one in the world, because it was not on TV, it was never mentioned there were no magazines, there were no celebrities, it was very in the shadows, and really the only place that people could interact with each other were in bars, which I think led to a lot of substance abuse, a lot of alcohol abuse, and that sense of isolation. I frequently say the reason that I have spent so many years doing public service and working on this as an openly gay member of the legislature is because I want young people, future generations, not to face the same, not even discrimination. You have to grow up to face discrimination at some point, but as a very young child, feeling different and feeling alone. And that's what we struggle for. But legally, we want to ensure that licensed professionals cannot do things that are not only discredited, but are harmful. So I'm wondering if we could just maybe expand this a little bit, since Jack did raise the issue of transphobia. The struggles we have towards passing legislation that would prevent discrimination in housing and in employment, that actually the Assembly's passed gender, I don't know, 6 or 8 times, and it doesn't pass in the Senate. So maybe, Jack, are you seeing, could you just talk without being specific about obviously any patients, just generally the kind of discrimination and the effect of that on transgender New Yorkers?
Well, yeah, I have a lot of patients who are living in a lot of fear. Some of them are my age, middle age, and they have professions, and they're coming out, and they're very worried about losing their job, they're losing their profession. Other people are just starting out, just coming out of college, or maybe still in college, and they're very worried about, you know, what's going to come next and what happens. You know, should I be out on my applications to work? You know, should I dress as I want to dress and be who I am? And it's a very difficult and painful process. So, you know, if you don't have the support of your company or your organization that you're working in, you can lose your job, you can lose your livelihood, then you lose you know, your ability to pay rent, and you're out on the street, or you're relying on family. And of course, that can be problematic if you don't have family that's supportive. So this is a real big problem.
Barbara, at Mount Sinai, what is the health system doing? Because there are for transgender New Yorkers issues around health care that are very specific. We don't have, the insurance industry hasn't come along, so that there are codes that affect, that seem to be gender specific, that are problematic for trans New Yorkers.
Well, I think at this point in time we've seen a tremendous amount of progress, but there's still a way to go. The lifting of the ban on Medicaid coverage for trans-related care in New York State was a huge step forward. However, now, as you said, Deborah, we're going to have to put some teeth into that in terms of what are the criteria then that both Medicaid and other payers, commercial insurers, will use to ensure that this kind of care will be covered for trans people. And that's still very up in the air. Even though most commercial insurers now in New York are saying that they will provide coverage for transgender patients who are seeking transition-related care, specifically hormone therapy, surgeries. It's still many of the people I encounter and many of the patients that come into our system when they're trying to use that coverage still encounter a lot of roadblocks. Sometimes it has to do with their gender markers not being gender markers that are necessarily correlated to the specific service. We have a lot of gender-specific services that insurance covers. So for example, our trans men who still may need some care that is care that insurance companies cover for women, oftentimes find that when they try and receive that care, they're blocked from coverage because their gender marker is male or it doesn't conform. So there's lots of smaller things, and hopefully we'll be able to develop some criteria that insurers can use or be held to. However, there isn't a great enough incentive for them to do that, and I think by having some legislation that would specifically protect transgender people from discrimination across the board, not just employment, as Dr. Pula indicated, which is still a huge issue, but also in terms of healthcare discrimination, that still exists. That would provide a greater incentive for us to be able to advocate for and get some criteria for coverage that makes sense, that's just, that's fair, and doesn't put up all of these barriers and challenges, whether it's for public coverage like Medicaid or commercial insurance coverage. There was one other point I wanted to make too. When you were talking about ensuring that it would be illegal to practice any kind of conversion therapy, particularly on adolescents, but that's also true for adults. Many adults will seek that kind of therapy because it's being touted or promoted as effective, and they need to know that it's not, and that needs to be out there. And so I think, again, making it illegal, sending that kind of message, sort of consumer protection for people who would promote that they could do this and people that would engage in these therapies to their own harm. But the other thing I'd love to see when you talk about licensure and state education agency is we've been fighting for decades, and it's gotten better, but fighting for decades to make some kind of mandatory LGBT training, both for medical education, behavioral health education, training substance abuse providers. I think the state has come a long way in making those trainings and good trainings available, but there's still no mandate to achieve licensure, to be either trained on that or to renew that licensure to show that you have LGBT cultural and clinical competency training. And I think if we kind of look at ways to do that, that would be effective, that would help a lot too. We want to train our next, that's what we're doing at Mount Sinai. We are training the next generation of physicians to know how to most effectively treat LGBT patients with the latest in evidence-based care. That is so important as well.
You raise a very good point. The reason that we have focused on minors is that the state has a feeling that adults, we don't tell adults what to do when seeking assistance, mental health assistance. However, one of the things that we saw in our hearings that we did on the bill was that there were adults who were parents. Jack mentioned that this is frequently it's parents who are bringing youngsters in to see a therapist. Parents said, we thought it was okay because they had a license from the state of New York. And I'm wondering if that's, since you've worked on some professional associations, whether that was part of the discussion in terms of trying to say, hey, people think that once the state says we're licensed, that makes it okay. And is there any opportunity for these associations to be more vigorous in their opposition to this practice so that we can move the state Senate to move to a different place?
Well, I mean, I think these associations, the AMA, the two APAs, the Academy of Child and Adolescent Psychiatry, and all the different professional associations for, master's level social workers who do therapy, et cetera, they all come out against this. They've all done that because they can see that this is a huge problem. They don't want to be associated with it. And I think these days when people are going through training, I think for the most part, that is what they are learning. That is emphasized. But of course, you have some therapists coming through, some doctors coming through who are going to disagree and are going to have a different view. And when they get out into the world and start practicing and they get further and further away from training and they get further away from maybe the professional association that they're a part of or that they may not even be part of, they sort of fall out of the fold, and then they sort of go and they do what they want to do. And that's really where the problem lies, is with people like that. That's one part of the problem that this bill would actually really help, because patients seeing that person and realizing that this is harmful to them would then have a mechanism to go through, and that person could be legally held accountable. The second problem that exists is with people who are not licensed, who are just out there doing some sort of therapy or life coaching, and that they're calling themselves, a therapist, but they're really not licensed. That's the issue in New Jersey right now with consumer fraud, and they're going after, there's a lawsuit there where they're going after people who fall in that category. So I'm very concerned about people who are licensed and are doing this kind of work. And I think the professional societies are trying to do what they can. Could we be doing more? Probably. We could probably be doing more lobbying and advocacy. I think everyone's very strained and drained because we're all professionals and we're working, and then we're doing voluntary work. Our associations like the APA do have a lot of staff, and so there is a certain amount of power there and manpower to get behind these things, and I think we're trying to promote that as much as we can.
Well, that's very good to hear. I think that the concern that I have is the financial incentive, because it's an impossible thing to do. So you could keep somebody in therapy from age 15 to 20 on a regular basis and actually not make any progress on changing someone's sexual identity or gender identity. And then at the same time be doing terrible damage. And there was a well-known political figure whose husband was known in the Midwest. This is how he made his fortune, if you will, and very unhappy about that visibility. But the question that I think comes up for people who are concerned has to do with those people who counsel, so a pastor, minister.
Right.
Now, the bill does have essentially some sort of religious exemption or some reference so that we don't concern people that their priest or their rabbi is going to be in trouble, even though it's a terrible thing to do to a young person. But if they are a licensed individual, they cannot do this. I hear what you're saying about the unlicensed, and it is a concern that we have, that people can hang out a shingle. And increasingly there are individuals who are licensed perhaps at one level or certified in a setting, but not licensed fully as a psychologist, that could be out in the world, hang up a shingle.
This is where it becomes very important for medical providers who are primary care providers, pediatricians, people like that, who are likely going to interface with families like this and the children. Now, that's a very tricky situation, but they can have an influence, and they certainly should be screening for things like depression, anxiety. They should be having private conversations with the patient, with the minor, and trying to find out what's going on with them. And if they suspect that they're in one of these treatments, try to use their resources to educate the family and let them know how harmful this is, and talk to the child, and maybe give the child some resources. I mean, I think especially when a minor is really not assenting to this. I mean, it's a problem no matter what, across the board, but if they're not assenting to this and they're a little bit, they're sort of crying out for help and they are getting more traumatized, a pediatrician or someone in the health field who knows about this could really help.
I wanted to add to that a little bit too. I think around a lot of other issues that we've done around health and health inequities and health disparities, one of the things oftentimes is we always try to control supply, and this in a way is about that, which I'm not saying it isn't one technique or one thing that we need to do, but we also have to influence demand. And I think you were referencing this earlier on when you talked about parents just wanting the best for their kids but not knowing what the best is. We really need to put some effort into what I call consumer empowerment, consumer education. We need to get the word out to parents, to families, and to people in the LGBT community, youth and adults, what is effective and what isn't effective and what is allowed in evidence-based practice. And so people don't go seeking this kind of help, whether they're adults or parents don't go seeking this kind of help for children. And Dr. Puller's right that pediatricians oftentimes have a lot of influence in that regard and could provide that education. But I think also the community needs to sort of pick this up a little bit more and provide that kind of education, and the associations can help with that by not just maybe testifying at legislative hearings, but doing some very, very active promotion of evidence-based practices to help people strengthen their sexual orientation identity and their appropriate gender identity, to celebrate it, and to show that these kinds of techniques are fallacious, they don't work, they're ineffective. So a little more sort of consumer-oriented education, I think, would be really helpful, particularly if a bill like this passes. It's an opportunity to really come out for evidence-based practices that reinforce and support sexual orientation and gender identity.
Well, I'm glad you said celebrate, because we are taping this during Gay Pride Month, and too often I spend most of June in Albany, and as opposed to in my own community, able to participate in many of the activities. But I do think that we have moved a little bit, we've moved the dial a little bit, in that the support for the bill is bipartisan, and not just our one or two usual suspects on the other side who are a little bit more enlightened, but we had a fairly broad representation from our friends in the Republican Party on this very matter, which I have to say is a huge step forward in our House. We have too often had support that was far more limited in terms of just being Democratic support. But we are starting to see some changes. But the society is perhaps the best place. And we see much more information being made available. The fact that there are, and I referenced the fact that when I was growing up, there were no TV shows. Now, you know, there are a range of them. Of course, you know, silly comedies on the one hand is not necessarily the way in which we want to educate, but it may be the best way to change the societal view.
Well, that's one of the advantages actually to the internet. I mean, I have a hard time with keeping up with all the Facebook and Twitter and all that, but it is a way for people to connect. And I think when bad things are happening to youth and they're screaming out and they don't have a community or family that's supportive, they have these other resources, which is kind of amazing, and they can use them to connect with other adults and youth who might advocate for them. Unfortunately, you have someone like Leila Alcorn, who wasn't able to get the help that she really needed. She got very harmful, quote unquote, help, and ended up ending her life. But she sent her, suicide note, and it went on Twitter, and it landed at the White House, and it's part of why, President Obama has come out and talked about conversion therapy. So that's remarkable. I mean, that wouldn't have happened, I think, maybe 10 or even 5 years ago, right?
And of course, we've seen, with all of the publicity recently around Caitlyn Jenner coming out. I think, however you feel about that, I think there's been a tremendous positive effect on people who normally wouldn't pay attention to the issue or might be turned off by the issue in a positive way. I also just wanted to add that if people want to know more or need some help, they can certainly contact me in the Mount Sinai Health System. And we have a website at www.lgbthealthservices, all one word, .org. And I'm certainly available to make referrals both inside the system and out for people who are seeking more information or help.
Well, that's a tremendously important, and we just have literally a few moments to go. So let me just say that I want to thank you both for a fascinating discussion and for sharing your expertise and your experience. And if viewers would like to discuss this or any other issue with me, I invite you to contact me using the information that'll be on your screen. I'm New York State Assembly Member Deborah Glick. Thanks for watching Represent NYC on Manhattan Neighborhood Network. It's been terrific. Thanks so much.